Dr. Barrow, thank you for joining us today to share your story and your experience about being tested positive for COVID-19 virus. Please, as we begin, give us your background about your schooling and your practice there in Houston, Texas.
Hi, thank you for having me. My background, I went to Shoal College of Podiatric Medicine. I've practicing for about a little over 13 years now. I recently opened my own practice here in Houston. It's been open for about 2 years. It's Soul Aesthetic here in Houston. I specialize in regenerative and aesthetic medicine of the foot and ankle.
So, what is the atmosphere dealing with COVID-19 virus there in Houston, Texas, compared to the United States? What are you being told by the authorities there, and how are people reacting to what's happening?
I think that we've been a little bit more lenient. Ours is not a shelter in place. It's a like a soft, stay at home or work from home. Personally, I don't think it's the right decision at the moment because people still kind of look at that as they're still going out to the parks. They're still congregating in certain areas, so it doesn't look as serious as it should. But we there is a lot of people working from home. I mean, if you're out now, you wouldn't see as much traffic. Obviously, here in Houston, we're what, the fourth or fifth largest city at this point. As far as populations. So there are a lot of people that are home, but again, I think that it could be taken a little bit more seriously. I think they should do a shelter in place, honestly.
What were you experiencing that led you to get tested for COVID 19?
So the week of, I tell you that if when I backtrack everything, the week it started March 16th, Monday, March 16th. Actually, it presented as allergies. It's high pollen season here. It's allergy season. I had a nasal drip. It felt like allergies. I was taking Claritin and Benadryl for 3 days because it felt like allergies. And the only thing that prompted me to take my own temperature was that late Wednesday. Felt exhausted and fatigued and tired, just overall tired. And I didn't feel feverish. I didn't feel hot, but it just prompted me to take my temperature. And at that point, it was 100.8. And again, I never felt hot. So it's deceiving. And I would say that this virus hit at the right time. It's hitting during flu season, derby season. It basically is tricking all of us, thinking that we just have allergies. So that's how I presented. And I had been everywhere in the 2 weeks prior to that. Everyone always asks, "Well, did you get it?" I can't tell you that someone came forward and said they were COVID positive. I mean, I was everywhere. I worked out at the gym 6 days a week, grocery stores, restaurants, out with friends, nursing homes. I performed surgery. I'd been everywhere in the 2 weeks.
What was the key factor that made you go ahead and get tested for COVID 19?
Oh, the fever, hands down. Once I saw I had a fever, period, and I knew, and I mean, knowing, we know our clinical background. We pretty much knew what to look for. It was the fever, hands down. I wasn't, it at no point did I think that, oh, this could be something else. Once I was running a fever, I had it. I wanted to get tested so that I could inform all the nursing home facilities, the surgery center, all the patients that I had seen the past couple weeks. That was the reason to hurry up and get tested, because there was no reason for me to warn or inform everyone and incite mass panic based alone.
How was your experience for getting tested for COVID 19?
Oh, it was infuriating, frustrating and infuriating. That was that was hands down the reason that I went public with everything, to expose the difficulties in getting testing. It was prudent of me to think that just because I was professional that my sample would have been expedited or taken a little bit more seriously. It wasn't. I could, we on Thursday. So I had a temperature on Wednesday. I said, okay, the next day I'm going to go in and get tested. They had run out of tests. Anything you advertise is free here in Houston, it's going to run out very quickly. It was at that point I did, you know what, I'll just pay for it. I'll find somewhere. One of my colleagues sent me a link that one of the urgent care centers was offering, you want to get the test, $200. I'm like, fine, I'll go. So I proceeded to go to that urgent care center. They gave me two options: either take the Quest diagnostic test and I'd find out in about 7 business days, and that was $67, or I could come back the next day and pay $200 for a 24-hour turnaround. So obviously I'd rather come back the next day. I wanted to know as soon as possible so I could inform my patients. So at that time they did a rapid flu swab. It was negative, which I just knew I didn't have the flu. And I came back the next morning to get the other test. Unfortunately, I was misinformed, and they said that my results were going to come back in 2 to 4 business days and not 24. And they said, well, the lab reports your results 24 hours after they receive your sample. And since it was Friday, it wasn't going to go out to the weekend. The lab may not get it till Monday or Tuesday. So I wasn't going to know till Tuesday or Wednesday. So at that point I said, okay, they had already had my sample. I proceeded to go back to the free testing because they were reporting, 24 hours for the free testing. The line was over 10 hours long. At that point I was sick and I wasn't going to sit 10 hours. So I was going to try to find another option. Harris County here in Houston was offering healthcare providers, first responders testing at that time. So I got, I called that number and they told me that I couldn't test because I didn't have a badge, a photo ID badge. And I don't, because I'm not with a hospital system. I have a private, office. There, I have a photo ID badge, and I said, my medical license I can show you. And she said, well, that's why you didn't that link, because we're only testing healthcare providers that have a photo ID badge. So I said, well, regardless, I've seen patients at 2 nursing homes and a surgery center. In my opinion, I felt like that was reason enough to get tested, and I kept telling that story over and over again, and no one saw that as a sense of urgency to expedite my sample, which was really frustrating because, I'm exposed to the immune compromised population and, exhibiting symptoms. I would think that would be reason enough to run my sample sooner than later.
When you got your positive results, what was the first thing that went through your mind, both personally and as a physician?
Well, like I said, first of all, I self-isolated based on my symptoms. Like I said, I just knew, and I had gotten all of the symptoms from the, shortness of breath, the loss of taste and smell, the high resting heart, the dry cough that then turned into a pre-cough, fatigue, exhaustion, chest tightness. I had all the symptoms. So I self-isolated based on that anyway, just to put that out there. So while I was still waiting for my results and trying to fight and get them expedited, at one point the lab that had it lost my sample, and they couldn't find it for a day, and then they finally located it. And the way that the CEO of the lab emailed me on Gmail, which is a breach of privacy.
Right.
So I found out that Thursday morning on my Gmail, it says, Vanessa, you're positive. Please excuse all typos. So that's how I found out. Right. So anyway, once I found out, immediately I called my nursing homes, let them know, I called the surgery center, that's what I spent the entire day Thursday doing. So that's, I felt helpless as a physician because I had so many patients' lives in balance. You never know who could have been exposed to, and that was, almost anxiety inducing at that point. The fact that I could not tell them. I knew I had it, but I couldn't tell them until I had a positive result, and I was waiting forever for the results. So it was that you feel helpless at that point. That was my experience as a provider. I mean, as a person, uh, um, I think that my personal experience definitely was mild. And I mean, I could say because I'm healthy, because I work out every day, but we see young, healthy people succumbing to this. I've experienced it. Also, my family passed away 2 weeks ago from COVID. He was 52, young and healthy, no compromising underlying comorbidities, no respiratory issues. He was misdiagnosed as having an upper respiratory infection, which I think is what's been happening a lot in the beginning. And he was sent home with steroids and antibiotics, and he progressed rapidly over the weekend. He went into uh, on Monday, 2 weeks ago, Monday, he went to the Detroit drive-through testing, and his O2 stats were so critical at that point that they admitted him, and that's when they tested him. And unfortunately, he expired the next day. Mm-hmm. And he has a 16 and 22-year-old daughter, and the 22-year-old has recently tested positive as well. Her symptoms are mild, and she's recovering. She's doing well. But that just goes to show how communicable this is, and how we, in the beginning, the media was presenting this as, affecting all immune compromised and the advanced age, and it's not. And only now are we seeing that everyone is being affected. No matter your immune status, no matter your age, no matter your health status, you don't know how body's going to respond to it. Like I said, I'd like to believe that me being healthy is a reason it was mild, but that may not be the case. We still don't know a lot about this virus at all. We're figuring it out as we go, which is all the more reason to take it seriously and not underestimate it. And I feel like that is what we've been doing, is underestimating it.
Since you've been diagnosed with COVID-19, has the local Department of Health reached out to you to give you any guidance or any follow-up other than the self-quarantine that you have already put yourself in, even before you tested positive?
Oh, no one. And that's funny because everyone was like, well, what did they tell you to do? I'm like, no one talked to me. No one gave me any directions. Everything I knew, I knew from CDC guidelines. There was there's no outreach. I feel like people are not being managed well enough if they are symptomatic and at home. Any information that it continues to flow, stay at home. No one's getting real information. I think that if they do the research on them for themselves, they can see, drink warm liquids or take Tylenol if you're having fever. But no, there was no outreach. What I can say, and this kind of an interim in the entire journey, was that I actually was I contacted the Department of Health here in Houston, and I was able to get in touch with their epidemiology department, and so they kind of started following me, and they allowed for me to get a second test at the time, so that I could get. This was before my results ever came in from the first test. And they made it possible for me to go into an emergency room at one of the hospitals in the medical center and get the test done. But at that point, I was afebrile and I was asymptomatic, and I knew this test was not going to come back positive. And I remember telling the epidemiologist, I said, this is not going to come back positive. I know my first one will. I'm confident it will. And I said, but this one won't. And it did. And it wasn't a test to confirm my negative status, because the way you do that is 2 consecutive tests, 24 hours. So this wasn't that. It wasn't confirmed. It did come back negative, and I got it in 24 hours just to show that you can get the results next day. I think now you can get the results in 30 minutes or 5 minutes now. But regardless, my test came back negative at that point. But I knew that wasn't going to be the defining, result. So I just kind of put that in my back pocket. I'm like, thanks, but I know I'm not negative. But epidemiology, got all my information, and they're kind of tracking me and tracking anyone who tested positive that I was exposed to. To date, I know that no one has come forth that I've talked to. But but they're not going to do a confirmation of negative status. They only are doing those tests on patients who have a respiratory illness or are in the hospital. Those are the only patients that are getting repeat tests. Once you've recovered, you're considered recovered. And that's completed 7 days of isolation and have been afebrile or asymptomatic for 72 hours following that 7 days of isolation.
So after the period of isolation, are you able to return to the community, return to work, return to your practice the way things were before all of this happened?
Yeah, absolutely. Absolutely. Yeah. I'm seeing patients. I'm seeing a couple of patients this Friday, actually. Um, by this Friday, I mean, next next Monday will mark 4 weeks post symptom onset. So I'm way past that. But I'm seeing a couple patients on this Friday. So yeah, I'm released to the public at this point.
So, like yourself, those who have been cleared to return from self isolation and self quarantine, are they required to reveal their once COVID-19 positive status to their patients, their clients, their co workers, and others in the community that they come in contact with on a regular basis?
I don't know. That's going to be a very good question from here going forward. Um, I've been telling people, I already know that it's going to have a stigma, a negative stigma behind it. I had someone wanting to send, or I picked up a package or whatnot, and the comment was made, "Don't get close to her and don't touch her." And this is after I've recovered. And I pretty much know that that's going to be the stigma after all of this. And I don't know if there has to be a requirement to tell people. I don't know. I don't know. I think that that's something that should be addressed. But again, once you've had it, you're considered immune. If anything, I'm not walking around paranoid that I'm going to get it. So I have a different perspective being on this side of the fence now. I mean, clearly I'll take the same precautions, obviously wash hands and sanitize and all the good stuff. But I definitely have a different perspective now that I've gone through it and I've recovered. And as far as immunity, I mean, we're just, the CDC is basically just saying, it's following the trend or the behavior of viruses. Typically, you have a virus, antibodies to it. That they're kind of going by that. We don't know. Time will tell, obviously, but for what it's worth, they're saying, hey, you're immune, you have antibodies. Like I can donate, but I can't donate until 4 weeks post symptom onset. But I can, they're looking for donors for blood and plasma.
Given your experience, what would you tell us as healthcare providers and as community members in general, what we're not hearing about the COVID-19 virus on the news and other sources, what we're not hearing from our politicians and our local leaders? What should we know about protecting ourselves and going forward from here?
I mean, the biggest take home is that is don't underestimate this again, because I've experienced the impact in every way that you had to let go of all of my staff. My new practice is a little bit is struggling right now. I've had a relative, pass away from it. I have relatives who have tested positive, and I myself had tested positive. So, you know, don't underestimate it. You don't know how like I said, how you're going to respond to it. You don't know how anyone else onto it. I can tell you that when I contacted as many people as I could, that were exposed to me in the 2 weeks prior, maybe only people quarantined, and that's where again the virus is winning, because you don't feel sick, and if you have a job to go to and you still have the opportunity to make money, you're not going to quarantine. That's the problem. They tell us that if you've been exposed to someone who tested positive, you are supposed to quarantine for 2 weeks, because it can take 2 symptoms to onset, and out of all those people, maybe only 3. So someone could have been a carrier. Someone could have passed it on. You don't know. So I think that, my take home has been all this time is that don't underestimate this. This is serious. It's real. We're not taking it seriously. Yes, it's tough to stay at home and to shelter in place, but if we all do it and we do the drastic stay home for 2 weeks, then we don't have to drag it out for another month and 2 months and be inconvenienced all this time. But I don't think that we'll come together to do that, which is unfortunate. As far as what one can do to prevent the chances of it of being exposed to it, do what you've been doing, washing hands, social distancing, all that stuff does work. I mean, you've got to be a little bit paranoid that I told my friend, I said, you know what, walk around, everyone has it. That's the best thing you can do. If you walk around and you assume every single person has it might keep you safe.
Dr. Barrow, thank you very much for sharing your experience with the COVID-19 virus. We thank you for your words of wisdom, for your experience, for letting us know what we're not hearing in the news, for letting us know what we need to do to protect ourselves and our friends and our family and the community at large. Know that we are thinking of you, that we are praying for you, and that we thank God that your recovery is going well. If there's anything you need from us, please don't hesitate to get in touch with me or anyone else in the National Medical Association. For those who want to continue to follow her journey, follow her on Instagram. Her contact information for Instagram will be in the description of this video.
Thank you for having me. Stay safe out there.
You got it.